Welcome to this educational video about connective tissue disease-associated pulmonary vascular disease, or CTD-POD. This is a complex lung condition affecting individuals with underlying connective tissue disorders. We'll explore what causes it, how it impacts the body, and what can be done to manage it. CTD-POD doesn't have one single cause. Instead, it's a consequence of the underlying connective tissue disease. Conditions like systemic sclerosis, also known as scleroderma, lupus, rheumatoid arthritis, and mixed connective tissue disease are frequently associated with its development. These autoimmune diseases cause chronic inflammation and abnormal immune system activity that, over time, damage blood vessels in the lungs. Let's delve into the pathophysiology. In CTD-POD, the connective tissue disease triggers inflammation and remodeling of the pulmonary vasculature, that is, the blood vessels in the lungs. This leads to narrowing and stiffening of these vessels. This process, termed pulmonary vascular remodeling, increases resistance to blood flow through the lungs. As the pulmonary blood vessels become narrower, the heart, specifically the right ventricle, has to work harder to pump blood through them. Over time, this increased workload can lead to right heart failure, also known as cor pulmonale. The exact prevalence of CTD-POD is difficult to determine because it often goes undiagnosed or is diagnosed late in the course of the disease. However, it's estimated that a significant percentage of individuals with certain connective tissue diseases will develop some form of pulmonary vascular disease. Systemic sclerosis carries the highest risk. Research is ongoing to better understand the true scope of this condition. The signs and symptoms of CTD-POD can be subtle at first and often mimic other lung conditions. Common symptoms include shortness of breath, especially with exertion, fatigue, chest pain, lightheadedness or dizziness, and swelling in the ankles, legs, or abdomen. As the disease progresses, individuals may experience worsening shortness of breath even at rest, and symptoms related to right heart failure may become more prominent. Diagnosing CTD-POD requires a comprehensive approach. A doctor will start with a thorough medical history and physical examination, paying close attention to any underlying connective tissue disease. Further investigations usually include a chest X-ray, electrocardiogram or ECG, pulmonary function tests to assess lung capacity, and an echocardiogram to evaluate heart function. A high-resolution CT scan of the chest is often performed to visualize the lung tissue and blood vessels in detail. The gold standard for diagnosis is often a right heart catheterization, which directly measures the pressures in the pulmonary arteries and right side of the heart. Blood tests may also be ordered to assess the severity of the connective tissue disease and rule out other potential causes of pulmonary hypertension. While there isn't a universally agreed upon classification system specifically for CTD-POD, it is usually classified under pulmonary hypertension associated with other conditions. Pulmonary hypertension itself is divided into groups, with pulmonary arterial hypertension (PAH) being the main category relevant to CTD-POD. The classification also reflects the severity of the pulmonary hypertension, ranging from mild to severe, based on pulmonary artery pressure measurements. Unfortunately, there is currently no cure for CTD-POD. Treatment focuses on managing the symptoms, slowing the progression of the disease, and improving quality of life. This often involves a multi-pronged approach. Specific medications targeting pulmonary hypertension, such as phosphodiesterase 5 inhibitors and endothelin receptor antagonists, and prostacyclin analogs, can help relax and widen the pulmonary arteries, reducing pressure and improving blood flow. Oxygen therapy may be prescribed to increase oxygen levels in the blood. In some cases, medications to manage the underlying connective tissue disease, such as immunosuppressants, can help control inflammation and prevent further damage to the pulmonary vessels. Additionally, lifestyle modifications like pulmonary rehabilitation, regular exercise, a healthy diet, and smoking cessation are crucial for improving overall health and well-being. While CTD-POD itself cannot be prevented, managing the underlying connective tissue disease can potentially reduce the risk of developing pulmonary vascular complications. This includes adhering to prescribed medications, attending regular check-ups with a rheumatologist or other specialist, and adopting healthy lifestyle habits. Early detection and intervention are also key to slowing the progression of the disease. The prognosis for individuals with CTD-POD varies depending on several factors, including the severity of the disease at diagnosis, the underlying connective tissue disease, and the response to treatment. Early diagnosis and prompt treatment can significantly improve outcomes. Ongoing research is focused on developing new and more effective therapies for pulmonary hypertension associated with connective tissue diseases. Researchers are exploring novel drug targets, investigating the role of inflammation and immune dysfunction in the pathogenesis of CTD-POD, and developing more sensitive diagnostic tools for early detection. These advances offer hope for improved outcomes and a better quality of life for individuals living with this challenging condition.